The participant that we studied has dyskinetic cerebral palsy, but more specifically a subtype of that type of CP called athetoid cerebral palsy. And it has some of the characteristics are fluctuating muscle tone, fluctuating movements, poor use of midline, those type of things. So it's not one that we see often because it makes up a smaller percentage of the incidence of CP. So our participant, he was 19 years old at the time, and he was looking towards doing a work training program, getting into the workforce, what he might be able to do. And it kind of presented to him that he needed to be able to use his hands better.
We know that people are practicing in lots of different ways, and we don't have a lot of good evidence about how to practice for kids with Down syndrome. So we were really wondering, well, what are therapists doing? What are physical therapists doing? And how are we treating kids with Down syndrome? Is it similar across the country? Is it different across the United States? What does practice look like?
Physical therapy practice in the treatment of kids with Down syndrome is very variable from therapist to therapist. So this study's aim was to get an idea of what those PT-related problems physical therapists are seeing in kids with Down syndrome, and then what are the interventions that they're doing. And then alongside that, we also took a look at what are the outcome measures that physical therapists are using, what are some novel interventions that they're using, and what are interventions that they're using that may not have they may not have resources.
It seems like most therapists are really looking at joint stability and alignment, functional motion, and muscle performance. And I think that's a really great starting point for anybody, but also to think about all the other things that could be going on in a child with Down syndrome, and not to forget that there's other systems that we can impact in our treatment that are affected.
We don't really know a lot about what is delivered in physical therapy sessions for children with cerebral palsy in the real world. Most of what we know is based on what therapists bill, what their billing codes are, and also just the number of visits that children have going to see physical therapists. So we really were going for learning about what is actually happening in real world care and what types of physical therapy interventions are therapists delivering in our clinic setting.
Serial casting is a very effective method to get dorsiflexion, and that kids, I think a lot of people would think that kids with autism wouldn't tolerate it. You may have to do something a little bit differently, like this little girl that had anxiety. We actually had to cast her at her house, with with her behavioral supports in front of a movie and with her treats. So you may have to do things a little bit differently, but that the same approach of gaining range of motion for just an idiopathic toe walker can also work for a child with autism.
The accelerometer was an actigraph, which is like a watch. And so they put it on their wrist. Typically with past studies, it usually is put on the hip because they're trying to get more of a measurement of walking. But the children that we were working with were wheelchair users or other assistive devices. So we wanted to make sure it was put on the wrist, because when you're propelling a chair, then it would provide that data about movement by propelling. The GPS we put in a really soft cuff, and that cuff you could pull over their lower leg, and so it rested on their ankle.
In Sweden, most children with cerebral palsy that are non-ambulant practice weight bearing every day in some sort of stander or standing shell. What I have been doing is putting these children in standers that can make them stand like this. 30 degrees from normal. That is a lot, and that is almost what those kids can achieve. But as they can when they are small, we are trying to keep this ability.